Hi, I'm Dr. Tom, and I want to thank you as always for listening in to us on our YouTube videos as well as on our Facebook fan page. We really appreciate you. So one of the topics that have been really kind of hot lately in our office is patients coming in and complaining of droopy eyelids. That seems to be the big concern, and I think part of it is because we're just coming out of shelter in place, we're dealing with the COVID pandemic, and many of us being good citizens are wearing masks, and so we're focused on our eyes. And it seems to be really become at the forefront of concerns of our patients. So I thought we'd just do a quick little video on what you can do. So first of all, as you know already, one of the best ways to open up our eyes is using Botox. But there are some other areas where we don't want to use Botox or Dysport, which is the other Botox that we use in our office. And so let's just review that. So we'll look at the anatomy of the face a little bit. So we know that there is the frown, and this is this area right here, and we get the 11th. There's a combination of muscles. We have a muscle right here which tends to pull down. It's a depressor, okay, so it helps to pull the brow down, and that's going to go against lifting up our eyelids or lifting up our eyebrows so that we can have a more open-eyed look. So what do? Well, we inject Botox right here, right in the middle of the procerus muscle, it's called, and that helps to stop this pulling down of our brow. We also have two sausage-like muscles called the corrugator muscles, which pull like this, contributing to the 11th. So we inject here and here into the head and the tail of the corrugator muscle, and not only does that soften the frown, but what that does is help to lift up our eyebrows on the outside. Now, for women, they love that because they like the arch, okay? Now, we don't want it to be too much. We don't want to get the Spock look, but certainly they like the opening up of the eye, and that's a very classic feature of beauty for women is to have an arched eyebrow. So treating the frown area between the eyes with Botox or Dysport, the other Dysport that we use in our office, we can effectively help to open up the eyes. We also have a muscle that goes around our eye, just like this, and it's called the Orbicularis Oculi, the Orbicularis Oculi, and that's the muscle that comes around here. And when we smile, it tends to pull right down in this area here, and so it tends to depress the outside of our eyebrow. Also, when this muscle contracts, we tend to get smile lines right here, and so in order to avoid that, what we will do is inject Dysport or Botox in the area right here on what we call the outside or the lateral aspect of our orbital rim, and this is right in this area here, and that relaxes it, so even when we smile, we don't get the crinkling here, and it helps to open up our eyes, okay? So myself being 3/4 Chinese and 1/4 Greek, but I phenotypically have more of an Asian eye, obviously. I have to be concerned about my eyelids hanging down as I get older. So I specifically have Botox or Dysport in these areas right here between my eyes and on the outside here to try to open up my eyes some. So those are the areas that we would recommend that you definitely have Botox or Dysport injections. I mentioned that there can be an area where we should avoid it, and that's what I do. So why does Dr. Tom, who can get his Botox in the office, anytime he wants it, or Dysport anytime, why does he put up with these horizontal lines in the forehead? Well, the muscles that pull up our eyebrows, like this, are called the frontalis muscles, and they're two. They're a paired muscle, one here and one here. They also, however, cause the horizontal lines that we see up here. So when patients come to see us and say, I don't like these horizontal lines, and I'd like to have them treated with Botox or Dysport, we certainly would be happy to oblige them and treat that area. But as we get older, and we have to tell our patients, especially older patients or Asian patients phenotypically, that if we treat this area, you may not be able to recruit the frontalis muscle to lift up our eyebrows, okay? And so I need that for visualization, for seeing, as well as part of sort of the emotion of my face. So I opt to put up with these horizontal lines on my forehead, and I don't treat them. We can treat them maybe with a decreased dosage. It's called a microdroplet technique, and where we would put in a little bit less. You're not going to get the same profound kind of erasure or softening of those horizontal lines, but we may be able to soften them enough for you, for your desires, but allow us still to keep some activity of our frontalis muscle to lift up our eyebrows. So that's an area that you have to be very careful. And if possible, I try to avoid injecting that area. And most of our patients, except for the most youthful of patients who just want to get rid of those lines, okay? One sort of gender-specific aspect of that is in men versus women, okay? So when we look at the classic beauty models, okay, and especially for women, it tends to be the arched eyebrow. But for men, a little bit heavier eyebrow is felt to be attractive. So I know it's not fair, ladies, but that's one of those things with aging where the men's heavier brow doesn't seem to detract from their handsomeness, if you will, their appeal. And some people who are classic for that would be George Clooney and Tom Cruise, where the brow is coming down. Especially Tom Cruise, who has sort of that boyish charm and look in his face. But if you really study his brows, they're actually quite low, and that's considered to be attractive. Unfortunately, the late Kenny Rogers, there was a time when he had some cosmetic surgery. He probably had a brow lift that lifted up his brow so much, and it tended to feminize his face or make him look chronically surprised. So that's the next concept that we have to understand with our droopy eyelids or our droopy brows is, what about a brow lift? Okay, so everybody has different opinions. If somebody has severe brow ptosis or droop, ptosis is our medical phrase, then it may be indeed appropriate for that patient to get a brow lift. Now, typically it's under general anesthesia, it's an incision along the hairline, and the skin is lifted up and pulled up, very much like a facelift this way, okay? In my opinion, when done in the appropriate patient and done with a moderate lift, it can look very good. But many times we tend to see the patients where it's been overlifted, if you will. So they look surprised for years until that begins to soften and it begins to drop down into a more natural position. So brow lifts can be performed. They can also be performed through smaller incisions, about right in here. They go in with the scope to do the procedure. But again, there can sometimes be issues with the changing of the hairline, and a lot of times, especially in younger women, they don't appreciate that sort of side effect of the procedure. And again, for me, it's just not really where I would recommend most of my patients. But again, if it's something that I think they need, I know several excellent facial plastic surgeons who I'd be happy to refer my patients to if I did indeed think they needed a brow lift. So that's one thing to be concerned about. So how do we get a brow lift if we're not going to do surgery? Well, one of the best ways to do that is actually with fat grafting. And for those of you who know me, well, you know that fat grafting is one of my personal niches that I love. I love fat grafting, and that's where we do under local anesthesia, liposuction of an area. We harvest the fat, and we can inject it in the face. Most of us who study cosmetics now know that part of the paradigm of how we age is changed from our skin stretching to where our face is more of a balloon. And we're not talking about a big fat balloon, but it's more of a balloon. And then as we get older, as the volume of our face begins to decrease or resorb, that balloon begins to sag down. And that's what we see. And that also occurs in the forehead. So one of my favorite places that I like to inject fat is the forehead. I love injecting fat in that area because just adding some volume in this area and under the eyebrows can lift the forehead up. And you only need a few millimeters. We're not talking about an inch, okay? Talking about a few millimeters that can make a big difference on opening up the eyes. But what if we don't want to do fat grafting? What else can we do? Well, many times I'll take filler, like Restylane, the Juvederm family of fillers, and I'll inject it under the eyebrow. And that actually will help to lift up the eyebrow a little bit and lift the eyelids up a little bit. But again, we're talking millimeters, but that subtle difference can make all the difference in the world on how our eyes are perceived and how we look. Another type of filler that we use is Sculptra, which is a sterile powder that actually is polylactic acid, which mixed with sterile water can help to build collagen. And so we will use Sculptra and inject it specifically in the temple areas. And as we inject in the temple area, that helps to pull the eyebrow and eyelid up. So we'll inject Sculptra in the temple area, even out into the hairline, which tends to pull things up. So that's another area that we can do. If you're thinking, I want to stay away from injectables, is there anything else we can do? Again, we need to understand that some of the non-invasive technology is not going to give you surgical results. Sure, there's the occasional patient who will get that home run grand slam, but for most of the time, if you're being minimally invasive, you're not going to get that surgical result, so you need to be aware of that. But thermage, which is radio frequency, there's also ultrasound therapy and other radio frequency type modalities which can be used. We happen to like thermage in our office, radio frequency, and the whole face can be treated, but specifically the eyelid can be treated as well. And that helps heat up the eyelid, build up collagen to try to get a little bit of a lift, okay? And again, it's not surgical, but sometimes just a millimeter or so change can make a world of difference on how our face is perceived, okay? So that is pretty much the non-invasive ways of treating the brow, to try to get the brow to be lifted, all right? If you have excess eyelid skin, which we tend to think is being part of the brow, things have dropped, well then a upper blepharoplasty would be appropriate. We perform that at the Aesthetic Laser and Vein Center. We'd be happy to evaluate you for that procedure, but that would be to take this excess skin and simply remove the skin under local anesthesia. So you have an incision which pretty much hides in the crease of the eye, and that helps to open up the eyes more, okay? But when we evaluate you for that blepharoplasty, that upper eyelid skin excision, we have to look at the brow as well. So for many patients, if they're willing, I would love to do facial fat grafting, specifically the upper brow and forehead area, under the eyes, which gives a very nice, youthful, natural look, and then later do an upper blepharoplasty. But if we're only going to do a blepharoplasty by itself, it certainly can be done, but once again, we have to address the brow, and if it's felt to be appropriate for you, then I would refer you to my facial plastic colleagues who do brow lifts and to have that performed ahead of time. So that's it in terms of surgical procedures to try to open up our eyes. And of course, prevention can't be prevention. If you're young enough, please, 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 good moisturizers of the skin, sunblock, sunblock, sunblock. Wear hats, protect your eyes from the harmful effects, aging effects of the sun, and sunglasses, okay? Because we all think we look kind of mysterious, kind of famous when we put on sunglasses. Well, there's a good reason to do that, to help to protect the skin of our upper eyelids, our brow, and our forehead. So I hope that was helpful. I appreciate you once again checking in with us to learn about our droopy brows or droopy eyelids. And if you have any questions, please call us at the Aesthetic Laser and Vein Centers, and we'd be happy to, at this time, offer you virtual consultations and then coming in for personal one-on-one if we feel that it's appropriate for you to have a procedure with us. I really appreciate you tuning in with us. Please stay healthy. Take care.